When I became ill and didn't have health insurance and had no clue how I was going to pay for any of the procedures that I was told that I needed in order to survive, it was terrifying. And to be able to better manage stress, undergoing that amount of pressure, and we can all feel that, even if you have the best health insurance. When you're facing surgery, it's frightening because there is that level of uncertainty of how well the procedure's going to go and how well you'll recover. And if you're a mature adult like myself, then you also have a concern about your quality of life and if you're going to require future surgeries. That's a question that's always in the back of my mind, is what's around the corner and what to prepare for. That is my proactive approach to healthcare. That's the foundations of the concepts on my website that are offered for free. And they're the ways that I have been living my life to better manage chronic conditions, knowing that I received joint replacement as a younger woman. I was 46 years old. And now that I'm 60 and that I want to do my best to take care of these joints and to manage my chronic conditions, to remain active and vibrant, I want to keep on working, I love to travel, and I want to be independent. I don't want to be a burden to my family. And that's something that lifestyle medicine and healthcare practices can do. I'm going to share in the description below the shareable link to the PDF. It basically summarizes the recovery tips in here that were recognized by the medical professionals that I was working with. They're some of the reasons that my book was nominated for the 2018 AARP Purpose Prize. I've had a number of terrific reviews, and yes, I'm giving myself credit because I'm proud of what I put out there. It's been donated to hundreds of different medical institutions and orthopedic centers, senior centers, and the tips are helpful. That's why everything on my website has been offered freely, because there was a time when I didn't know whether I was going to survive. The first surgery that I went into, my surgeon spoke to me right before he wheeled me into the operating room that if there was a chance that they opened me up and I was full of cancer, that we had already agreed on what my family and I decided was going to be my next steps. Those are the important and humbling experiences that we can have. Now, are all surgeries that terrifying? Of course not. Though, as we get older and face more complicated surgeries and illnesses, things that aren't going to get well, that is also the humbling part of better managing chronic conditions, because I know that, yes, after joint replacement, everything closed up and the stitches were removed. I just have deep scars now, though I have artificial parts. They move differently, they feel differently, they're harder to maintain, and my life is forever compromised. And I have degenerative conditions like arthritis, so I know that there's aspects of my health that I'm not going to get well. Things will decline as time goes on. And by approaching that in a proactive way, I'm less frightened and I feel more empowered to take better care of myself, because this is what I've got to deal with right now. And I don't want to shame myself. I don't want to feel angry. There were certainly times when I grieved and I thought, why me? And I was frustrated and I thought, what did I do wrong? And there's a time and a place for that. Pain management does include grief and mental health, stress management. There's all aspects of that discussed in my book and in this free PDF that I'm going to share in the description below. And please take advantage of it because, as I said, they truly do apply to nearly any type of surgery. And they take you to that lifestyle medicine approach because after your procedure, whatever type of surgery that you recently had, are going to have, that a caregiver is going to assist you with or not, that the patient, it's the steps that you're going to take that day by day, all of those healthy lifestyle behaviors, your movement, your nutrition, the way you use your medication, the way you are ensuring that you receive enough rest, drinking enough water, just all of those basics. Those little steps, those are setting the foundation. Our body has a natural ability to heal, and we need to meet our body. We need to show up for ourselves. Because when we've been injured or when we're ill or we've been harmed in some way, whether we've fallen or broken a bone or something like that, then we need that extra care, that time. And something as simple as ice packs. There's a number of ways that you can better manage pain. And I don't want to discount pain medication. There's a time and a place for that. And we're also in a state of crisis with medication misuse and people having digestive and other endocrine problems. Now, as I said, I'm a health educator. I'm not a clinician. The advice that I'm sharing doesn't substitute medical care. I work with my healthcare providers.